Today, we're going to talk about a topic that affects millions of people: hair loss. It can be a source of significant stress and anxiety. For many, finding an effective solution is a top priority. One of the most discussed and widely used treatments is a medication called Finasteride. You may have heard of it under brand names like Propecia. It is a prescription medication, a pill taken once a day, specifically designed to combat male pattern baldness. This condition, medically known as androgenetic alopecia, is the most common cause of hair thinning and balding in men. Starting this journey can feel daunting, but understanding the treatment is the first step toward regaining control and confidence. Finasteride has a long track record. It was first approved by the FDA in the 1990s. Since then, it has helped countless individuals slow down, stop, or even reverse the progression of hair loss. It's important to see it not as a magic cure, but as a scientifically backed tool. This tool works to address the underlying hormonal process that causes hair follicles to shrink. When you begin this treatment, you are taking a proactive step. Understanding what finasteride is, how it functions, and what you might experience allows you to make an informed decision alongside your healthcare provider. This knowledge empowers you. It transforms you from a passive patient into an active participant in your own health journey. To understand how to manage side effects, we first need to understand how finasteride works. The science is actually quite straightforward. Your body produces a hormone called testosterone. An enzyme in your body called 5-alpha reductase converts some testosterone into a more potent hormone. That hormone is called dihydrotestosterone, or DHT. In genetically predisposed individuals, DHT is the primary culprit in male pattern baldness. DHT attaches to receptors in hair follicles on the scalp. This attachment causes follicles to shrink over time, miniaturization, leading to thinning hair. Follicles don't die completely at first. Instead, they produce shorter hairs, finer hairs, and less pigmented hairs. Eventually, follicles may stop producing hair. Finasteride targets and inhibits 5-alpha reductase. Think of finasteride as putting up a roadblock. Blocking the enzyme reduces testosterone conversion into DHT, resulting in much lower DHT in the bloodstream and scalp. Less DHT means miniaturization can be slowed or halted. For many men, that is a game changer. It gives follicles a chance to recover. Follicles can return toward normal size and function. Over months of consistent use, hair loss can stabilize. Some users may even see regrowth of thicker, healthier hairs. In simple terms, finasteride protects existing follicles from the shrinking hormone. Any effective medication has the potential for side effects. Finasteride is no exception. It's crucial to approach this topic with a calm and rational perspective. The vast majority of people who take finasteride experience no side effects at all. However, a small percentage of users do report them. Because finasteride works by altering hormone levels, the most commonly reported side effects are sexual in nature: decreased interest in sex, reduced libido, difficulty achieving or maintaining an erection, decrease in the volume of ejaculate. These effects are typically mild and often reversible. They occur because DHT plays a role in male sexual function, though not the primary hormone. For most men, the body adapts to lower DHT over time. Many who experience initial side effects find they diminish or disappear with continued use. This is a very important point. An initial reaction does not always mean you have to stop treatment. Your body may just need a period of adjustment. Open communication with your doctor is essential during the first few months. Online conversations can amplify these side effects. That can create the nocebo effect. Expectation-causing symptoms. Go into treatment with a balanced view. Be aware but not fearful. Other, less common side effects: breast tenderness or enlargement, testicular pain, mood changes like feelings of depression. While rare, report these to your doctor immediately. Your mental and physical well-being are the top priorities. If you do experience side effects from finasteride, do not panic. There are several practical, effective strategies you can discuss with your doctor to manage them. You are in the driver's seat. The first and most common approach is to adjust the dosage. The standard dose for hair loss is 1 milligram per day. Even lower doses can still reduce DHT effectively. Your doctor might suggest lowering the dose to 0.5 milligram per day or taking the 1 milligram pill every other day. These changes can often reduce or eliminate side effects while still helping your hair. Another excellent option gaining popularity is topical finasteride. It's a liquid or gel you apply directly to your scalp. It targets hair follicles while minimizing absorption into the rest of your body. That go local approach lowers how much enters your bloodstream, which dramatically reduces risk of systemic side effects, like sexual side effects. For many, topical finasteride gives effective treatment with a better safety profile. Timing can also matter. Some people find taking it before bed helps them sleep through initial mild side effects. Others find taking it with a meal helps. There's no one-size-fits-all. It's personal experimentation. The key is consistency. Take it at the same time each day to keep stable levels. Managing side effects is a collaborative process with your doctor. It may take trial and error to find the right regimen. Never change your regimen on your own. Always consult your physician. While we focus on medication strategies, we cannot overstate the profound impact of your overall lifestyle on how you feel. A healthy body is more resilient and better able to adapt to a new medication. Think of it as building a strong foundation. Regular exercise is a cornerstone of this foundation. Physical activity is a powerful mood booster, a natural stress reducer. It improves circulation, which is beneficial for both your overall health and your hair. It also supports healthy hormone balance, which can be particularly helpful when you are taking a medication that influences hormones like finasteride. What you eat, how you sleep. A balanced diet rich in vitamins, minerals, and protein provides the essential building blocks your hair follicles need to thrive. Foods rich in zinc, iron, biotin, and antioxidants support healthy hair growth. At the same time, getting adequate, high-quality sleep is when your body does most of its repair work. Poor sleep can increase stress hormones like cortisol, which can negatively impact both your hair and your overall sense of well-being. Prioritizing 7 to 8 hours of quality sleep per night is not an indulgence, it is a medical necessity. Managing stress is the third pillar of this healthy lifestyle approach. Chronic stress can wreak havoc on your body, including your hair. It can even trigger a type of hair shedding called telogen effluvium. Finding healthy ways to manage stress, such as through mindfulness, meditation, yoga, or spending time in nature, can have a direct positive effect. Finally, the most important strategy of all is to maintain an open and ongoing dialogue with your healthcare provider. Regular check-ins are not just for getting prescription refills. Your doctor is your partner in this process.